Well, hello everyone and welcome. We are going to get started today talking about hormonal acne. Causes, symptoms, treatments, prevention, what it really is, and most importantly, what you can do to make it go away. Nobody likes acne on their face, so we understand. Before we get started, check out skincaresumo.com and get your free 7-day acne diet meal plan. Acne diets are hands down the easiest thing that you can do. If you want to make a change in your life, it's by far the easiest thing that you can do is adjusting your diet. Your hormones react to what you eat, turns out, and blood sugar. This is an effect of blood sugars causing hormones to change, which ends up clogging your pores. It makes your sebum, which is the oil in your pores, go from thin and watery to thick and sticky, which clogs you up, makes nasty, deep down cystic acne lesions that we all know and love. And then this cycles an event where those pores start to get infected all the way down to the hair follicles. You've probably heard all this before. And then P. acnes and C. acnes, the bacteria on your skin naturally start to go crazy because they get really excited when there's a clogged up pore and they start feasting on all that delicious sebum and they start overgrowing. So then you get infection on top of clogged pore, which leads to the red, painful, nasty breakouts that we all hate. So how do we get all of this under control? Well, let's get started, shall we? Hormonal acne is also called hormonal imbalance acne, cystic acne, adult acne, because it can last well beyond the teenage years into adulthood, even up to menopause, and sometimes after menopause. So we're talking about a lot of people that deal with this. I saw a statistic, 85% of adults and teenagers in the world struggle with acne vulgaris, which is really what this is. It is important to see a dermatologist to make sure this is actually the kind of acne you have. But since it is the most common acne, that is what we're going to talk about. So at its root, hormonal acne is an inflammatory condition. That means your body is responding to some area of infection or it sees it as a problem. So your body, just like when you sprain an ankle, it swells up. Your body ends up sending all of your immune system to this spot to help. It's trying to help. So when you get a clogged up pore, your body ends up sending all of this response to this area, and it ends up getting red and inflamed and angry. And then as we just talked about, the bacteria starts to go crazy and it ends up being this whole cycle of nasty. And we end up with acne. This is why a good skincare routine topically is important because you need to use things like salicylic acid to really get deep down into the pores to help break up the sebum, and it can help. The problem is if you've got this inflammation going on in your body, the topical stuff is going to do something, but it's not going to fix the root of the problem. The root of the problem is the inflammation. So the idea behind using food to help hormonal acne is to reduce the inflammation that's going on in your body. And side note, it won't just help your skin. Inflammation causes all sorts of chronic illnesses. Cancer being the worst that I can think of off the top of my head, but it causes, diabetes, heart disease. Inflammation is like the basis of most chronic illness. So if you can adjust your diet to help that, then that seems like a hands down win. So what is hormonal acne? You're going to know it if you've got it. First of all acne is considered hormonal now. When we hear the word hormonal acne, we think of periods, women, right? Obviously, think of periods. And it does tend to flare up around a period. But this isn't just the time that you can get it. You can get it all month long. You might just get a few extra lovelies right around your period. Also, as we head into puberty, teenagers will get this more because their testosterone levels are up, their androgen levels are up. And yes, both men and women have testosterone. And as these hormones start to rage, your body responds. If you've got inflammation, these hormones can rage too much and your body ends up creating the thick and sticky sebum that we just talked about. So Hormonal acne happens when your body releases more of the hormones that stimulate the production of sebum, like androgen, which is testosterone, also estrogen and progesterone. Sebum helps keep your pores clean normally and your skin soft, and it's normal to have sebum in your pores. It helps kind of wash them out. But the problem is with inflammation, it turns into this thick and sticky stuff that ends up creating a whole lot of problems. So inflammation causes increased hormone production and triggers acne. So what is causing the inflammation, right? That's at the bottom of this problem. We want to get rid of the inflammation. We get that. But what's actually making the inflammation happen? Well, I will tell you, blood sugar. When you eat, your body naturally raises, your blood sugar naturally goes up. You've heard of diabetics. When you have a low blood sugar, you don't feel well. Diabetics have a different kind of problem where their pancreas really doesn't regulate it the right way. So they end up having bigger issues than if you don't have diabetes. So normal people, you don't feel well, you get a little hangry, we eat something, your blood sugar comes back up, you feel better, and naturally your body releases something called insulin, which we've probably all heard of by now, which is a hormone, releases the insulin, brings your blood sugar back to normal. The problem is, if you are constantly raising your blood sugar so much that your body has to produce a ton of insulin like all the time, you end up creating this cycle of spiking blood sugars, releasing hormones, and this ends up leading to the inflammation that we're talking about. It's also why people that eat, typical Western diets, which is just about everybody, and don't really care about how much sugar they're taking in or how many carbs and all of that. It's also why we can get obese, and then later we can get diabetes, usually later in life. It's why diabetes is becoming one of the biggest problems, health conditions that we have in the world. It's because of our diets. So all of that is tied together. So the key is to keep your blood sugar steady. You want to keep your glycemic index, is what it's called, nice and steady. You want to avoid those mountains, those peaks of blood sugar spiking, because that ultimately ends up causing the inflammation. So there's another hormone that gets released during this that you may have heard of called insulin-like growth factor, IGF-1. And in good research studies now, they've now pinpointed that this hormone gets released in response to blood sugar spikes. This helps your body manage the food metabolism and drives oil production in the skin. So while it's helping your body bring your blood sugar back down, it's also increasing and changing the oil in your pores. So when our bodies have high levels of IGF-1, it's linked to acne. Interesting side note that we talk about in another article is cow's milk has really been linked to IGF-1. This is why there's a whole thing, I hope you've heard, that cow's milk is linked to acne, hands down. The research did not support that dairy, like cheese and yogurts, were necessarily linked to it, although more research should be done. Always a disclaimer, right? More research should be done. But dairy has not directly been linked, but cow's milk has, especially skim non-fat. And, the jury's a little bit out on why skim non-fat over whole milk, but who's drinking whole milk besides a 7-year-old anyway? So anyway, easy fix, switch to plant-based milks, almond milk. I like oat milk, but the trick is you need to do it the ones without sugar, because adding sugar will, of course, spike your blood sugar. So keep your blood sugar and your stable by not taking in a bunch of added sugar, and keep IGF out of your life. And this should help reduce the inflammation that leads to hormonal acne. You'll know if you have hormonal acne too, because a lot of people get it along their jawline. It doesn't have to be there, but it is kind of known to be along the jawline, and they're deep and painful and inflamed. So if you don't end up fixing your acne, by the way, you're like, why should I do this? It's not just that it's annoying to have acne and you don't want to show your face if it's really bad, or you cancel a date because you've got a big juicy one and you just don't want to look like you've got a big old breakout. But if you don't fix it, you can actually cause acne scars, and acne scars are a problem for the future. You end up getting these deep divots, and you need to go back in later. If you want, you can get chemical peels, which are a bit spendy, but you can get chemical peels, microneedling. other invasive procedures to help get rid of acne scars. But I mean, you have to like go through all that. So the best thing is to try to get rid of your acne, get a handle on it now so that you don't have to do all that later. You can also get something called post-inflammatory hyperpigmentation, which is dark spots. So it's not dark spots necessarily from the sun. It's dark spots because your skin, some skins over others, are prone to getting hyperpigmentations when there's an injury. So like if you have a cut on your knee from falling off your bicycle when you were 7, and now it's a different shade than the rest of your skin, you are probably prone to getting this post-inflammatory hyperpigmentation. It's just a way that your body, after it healed the acne, it leaves this behind. And there's nothing you can do to really help that. Vitamin C later on, but of course, prevention is the best possible thing you can do. And then don't even talk to me about the depression and low self-esteem issues. We all know about that. It's probably how you found us. You're just looking for solutions. So anyway, we're in this together. Hang in there. It's a temporary thing. It's going to go away, I promise. Well, I can't promise that, but it's going to go away. Listen to these tips and see if it works for you. There is science to back all of this up. So without medication, if you don't want to, if you go to your dermatologist, they're going to tell you, things you may have heard already, tretinoin, Accutane, and all these things, and antibiotics, birth control pills, all these things can help some people, especially if your doctor thinks so, but changing your diet will help reduce that inflammation. Any diet that's focused on reducing inflammation can be a bit of an acne diet. The paleo diet is focused on anti-inflammatory. The whole foods diet, not the store, that 30 whole food one, that one is plant-based and focused on reducing inflammation. Anything that's really plant-based, meaning not a ton of actually the acne diet has no red meat in it. You can have a little bit of like lean meat, some salmon, which is hugely good for acne because of all the omegas, but definitely no cow's milk. And in the beginning of the acne diet for our 7-day meal plan at skincaresumo.com/acne, you will find it has no dairy. So we don't do dairy in the beginning for the first 7 days as like a cleanse, just get rid of any toxins and kind of detox everything, get you back on track. But the best acne diets will add in probiotics and vitamins, especially vitamin D, which can really help your skin get back on track. So check out that download because I put it together really, really well. I think, of course, I did it really well. But it's put together with these things in mind to really target what your skin needs right now to help you kind of cleanse. I have done low glycemic diets before, and I want to tell you that sometimes you get, if your body is really hooked on sugar, which a lot of us are because we eat this typical Western diet and we don't really think about what we're eating necessarily. But when you go through and start really thinking about reducing the sugar intake and getting into like a low glycemic meal plan, like low glycemic diets, you might notice that you start to crave sugar even more. You might even get a little aggravated. So make sure you're drinking lots of water and eating nuts, lots of protein, getting your vitamins. All of these things can help. And it is just temporary, just a few days, and then you feel all better. And you're clean, you're cleansed, you've been detoxed of the sugar. So important. So starchy foods, obviously processed sugared foods, they can all increase blood sugar and promote inflammation, and all of that leads to breakouts. So we want to avoid those things on an acne diet for hormonal acne. And then for hormonal acne, we mentioned getting into a good skincare routine. Definitely need to be doing a good cleanser. And if you wear makeup and sunscreen, you need to be doing a good double cleanse. Not as hard as it sounds. You wash with a good cleanser, particularly one with actives like salicylic acid, which is the only BHA, beta hydroxy acid, that there is, because salicylic acid does a really great job of getting deep down in the pores and hair follicles, and adding it into a cleanser just gives you a little added something. If it irritates you though, stick to gentle cleansers like Cetaphil or CeraVe are good ones. that I like. So do a mild, like fragrance-free cleanser, throw in an active if you can. And then after you wash, use micellar water on a cotton pad. This stuff is like super cheap. And you just put it on the cotton and then you just wipe your face with it down to your neck. Remember, your face ends at your boobies. And then go ahead and just rinse off all the water, and you have officially gotten all the sunscreen molecules broken down. The makeup molecules are broken down and washed away. That is the best way to clean your face, is micellar water after cleansing. And then if you can find a glycolic acid toner, that's really not a toner, but like after you wash, I guess it is a toner. I like the Ordinaries. Just put it on cotton, and then the glycolic acid works by exfoliating the dead skin cells and any dirt or excess oil that's left on your skin. So I love doing that. It's a little bit different than salicylic acid because it's a smaller molecule, so it gets deeper into the pores. And that one you don't rinse off, you just leave it on. And then you always need a moisturizer. I don't care if you have oily skin. You need an oil-free moisturizer. Okay, it's very important because, especially for acne, because it improves your skin's moisture barrier. So it reduces the redness and irritation. It prevents more inflammation from happening. I mean, the name of the game here is getting rid of inflammation. So throw on a moisturizer. Just find one that you like. Make sure it's oil-free. And even oily skin needs moisturizer. It just does. Always wear sunscreen, especially if you're using a topical acne treatment routine, because a lot of these actives will make your skin more sensitive. But trust me, as you get older, you will be glad that you wore sunscreen. When all your friends, when you get into your late 30s, 40s, and older, when all your friends start getting all their wrinkles and start looking old, you're going to be really glad that you were wearing sunscreen. So most dermatologists say to avoid typical toners, like anything alcohol-based can dry your skin out. The only one that I've heard Dr. Dre mention, Dr. Suarez is her actual name, but Dr. Dre, you know, the YouTube gal who I love, she recommends an alcohol-free witch hazel as the one exception to for toners, because it's unscented and it's very soothing. So if you do have a lot of inflammation, it won't dry your skin out. Another great thing to add is always talked about by Dr. Lee, my other two favorites. I have a lot of favorite YouTube influencer dermatologists that I listen to, but they are definitely talking about azelaic acid. At least one of them is Dr. Shah. Anyway, talking about azelaic acid, and The Ordinary makes a really good serum mixed with hyaluronic acid. So you get the plumping, moisturizing effect of hyaluronic acid along with the azelaic acid, which helps to reduce inflammation and any puffiness left over. And I've done a whole nother article, discussion and article on that on skincaresumo.com. So I'm not going to get into all that here. There are some anti-androgen drugs out there like spironolactone. You definitely need to see your doctor to discuss those, and birth control, same thing. Topical retinoids, most of those, they are over the counter. You can also get it prescription strength, but these are great to help boost new skin cells and increase like cell turnover. And it can even unclog pores. It does a really great job. Retinol for me has changed my life. I love it. But again, we have multiple other articles on that topic, and everybody with acne should be thinking about using benzoyl peroxide. It's one of the best over-the-counter topical antibiotics that you can use. It actually works because it kills the bacteria that's getting stuck under the skin and feasting upon your sticky, clogged sebum. So it actually kills that like head on, like targets it and kills it. So this is why benzoyl peroxide is often recommended by dermatologists. It can also like shed the dead skin cells and reduce any excess oil production going on. But again, if we can treat the root causes, these are just adjuncts to that. And then oral antibiotics, as we've mentioned, those are also prescribed obviously by a dermatologist. So Bottom line is the best way to get rid of hormonal acne is to eat an anti-inflammatory acne diet, something that brings in probiotics to you as well, and vitamins are all the better. You can take those as supplements, but eating things like, sauerkraut. I know not everybody loves sauerkraut. I do, but not everybody does. But eating things with probiotics or just taking the supplement. I mean, it's super easy to find a good probiotic supplement now. I like this 9-strain one that I got, and I'll put the link below here in the description for you on the products that I've mentioned. You can also make sure that you're using the gentle acne skincare routine along with eating an anti-inflammatory diet. And it's important to see your dermatologist and make sure that this is the kind of acne that you have. There are other types of acne out there, but they're just not as common as acne vulgaris. So the most important thing to get rid of your acne is get that inflammation under control, change your diet. Go to skincaresumo.com and download our 7-day meal plan and get into our community here, and we'll send you more information about how to get rid of your acne. You can start your 7 days, and then we have a link for even more recipes, or you can just keep recycling the 7 days over and over again until you get really tired of it, but it'll be a really good place to start, and it'll give you an idea of how to eat. This doesn't cost any more than going to the grocery store. This isn't like specialty food necessarily. And everything is delicious. I like it. Eat it all the time. So go ahead and get started. Skincaresumo.com. Get your download and let's get you on your way to having clear skin.